Welcome to today's podcast. My name is Pearl Brewer, and I will be your host. Today's podcast guest is Matt Eagles. Matt is here today to talk to us about concussions, specifically in sports, but also on the job. To set the stage for today's discussion, health and safety does not just apply to keeping health and safe on the job. It also applies to when we undertake activities at home or participate in sports. The reality is, statistically, more people will suffer injuries off the job than on the job. So today we want to talk about concussions in sports, such as hockey and football. We hear a lot, of course, about football concussions, two sports where the term concussion is often referred to. But let's start, Matt, with you telling us about your background and specifically what led you to the field of medicine you're working in today.
Thanks so much for having me, Pearlie. I'm happy to be here and chat about this topic. It's obviously very important to me. Just for a little bit of background, I grew up as an athlete. I was a hockey player and was fortunate enough to play both major, junior, and university hockey throughout my career. And, sort of in the aughts and early 2010s, as was pretty typical, I suffered a fair number of concussions. And when I was playing in university in my third year, I actually had a concussion that forced me to step away from the game. At that time, sort of writing was on the wall that I wasn't going to be a professional hockey player, and got interested in things that I might be able to get passionate about the same way I was about hockey. And medicine was something that piqued my interest. It certainly played a role in my decision to step away from sport, competitive sport, contact sport, and sort of safeguard my brain as I knew that I'd probably be making my future living with my brain as opposed to my legs. So as I, made that decision to step away from playing hockey, I shifted my energies and started applying myself towards getting into medical school. I was lucky enough to go to Memorial University's medical school in St. John's, Newfoundland. And then from there, my interest in brain injury led me toward the clinical neurosciences. And I think my background as an athlete led me towards a surgical specialty. So I ended up going into neurosurgery and trained at the University of Calgary with their section of neurosurgery for 7 years. And currently right now I'm doing a fellowship at the University of Illinois in Chicago in cerebrovascular and skull base surgery. So that's sort of where I came from, and feel very fortunate that I've been able to do this, having suffered a number of concussions. I know that some people aren't as lucky and take a longer time to recover, but I do think that my experience with them played a pivotal role in me sort of deciding on the field that I'd want to pursue.
Do you have any idea how many concussions you would have suffered?
I feel bad not being able to give you a solid answer because, when I was young, and even in, as early as Atom and Pee Wee hockey, it wasn't as well known a concept that a hit could cause you to be concussed without being a devastating loss of consciousness or really confused after, the idea that you might get a little bit of a headache after you get hit, and if it doesn't go away right away, that qualifies as a concussion, was a bit of a foreign concept. So, I don't really know the total number. I do know that when I was in university, I suffered 3 concussions in the last 10 months of my career, and that was really the impetus for me to walk away from the sport. And by that time, it was the early 2010s, and we were getting to be a little bit more familiar with the problems around concussion in sport. I think a lot of the things that we were starting to see with patients being diagnosed with CTE, or chronic traumatic encephalopathy post-mortem, was starting to come about, and the field was undergoing a sort of an exponential growth in knowledge. So by that point, I knew that things were not good to continually suffer head injuries over the course of an athletic career. But growing up, it was just, you'd get hit, you'd maybe have a bit of a headache after and not feel 100%, but the rest of your body seemed to be working okay. There was nothing obvious keeping you from going out and playing. You just sort of did it, which is certainly not what I would advocate for young people today, but it was a bit of a, we didn't know any better back then.
So your last concussion, what kind of symptoms would you have had during that concussion?
Oh, yeah. So the worst one I had of those three was the first one. And I remember this well. We were playing in Acadia, and I was going around a defenseman, and I just kind of got tripped up and went into the boards totally unprotected at top speed. And I was knocked out for a very brief period of time. Everything sort of went black. And then I remember coming to on the ice and trying to get up, and I couldn't get up. I don't know if you remember watching videos of Scott Stevens when he would, hit somebody in the NHL, and there'd be a bit of a bandy legs on the ice. That's what I felt. And I was very confused for about 15, 20 minutes. I had a hard time processing language, which I now know from my training is a condition called aphasia, which is a little bit frightening because, that's a very important part of the brain that deals with language. And after about 15, 20 minutes, I started to clear. And it took me probably about a week or two to start to feel well enough to attend classes again. I missed the remainder of that season. That was in January of, I think January of 2011. And then in the fall of 2011, I came back and played and had two more concussions in the first half of the season of that year. One was in training camp, just a bit of a stupid play on my part, and ended up colliding with a teammate and in practice, and that set me out for a shorter period of time because it was one of those, I've got some headaches and not feeling well for a couple of days, and so it took a couple of weeks, and then came back, and then I was hit pretty hard in Prince Edward Island in November of that year, and that was again I felt the flashing lights, headaches, difficulty concentrating afterwards. Had a hard time with that third one and getting back into classes. And I remember that being quite worrisome because as I mentioned, I sort of saw the writing on the wall in terms of my hockey career at that point and knew that I had to take school seriously. And that was when we decided enough was enough.
So personally, I've been involved in sports for over 50 years. And every time I hear a sports announcer refer to a player possibly having a concussion, they make it sound like it's something very minor, that you should almost be able to shake it off. And every time I hear that, I cringe a bit. For our listeners today, Matt, as a medical professional, what are the announcers actually referring to when they see a player that has been hit hard that might have a concussion? So, in essence, what actually happens to the head of player one when he or she gets hit in the head by the shoulder of player two?
That's a great question. I think it's an important thing to help people understand. So your brain is actually suspended within your skull, and it sort of floats around in a substance called cerebrospinal fluid, and it's not fixed in place. So when you are in motion, you think of the laws of motion in physics, right? When you're in motion, your brain is traveling at the same speed as you are. And there's not a lot, for especially for young people, there's not a lot of space between the skull and the brain, but there is some. So if you're in motion at a high speed, whether you're playing, running a route in football or you're skating down the ice in hockey, and then you come to a sudden stop, or your head comes to a sudden stop, well, your brain is still in motion, because there is a little bit of suspension there. So your brain can actually either rotate and sort of apply like a shear force to the neurons, or it can go forward and back and actually hit your skull and suffer what's called a contusion. Concussion is really a catch-all term that we use when someone suffers a clinical brain injury. So they have a clinical malfunction with their brain. Something happens to their brain that causes it to function improperly, but we really don't know the severity of it unless we get imaging. And I can promise you that there are some people who are diagnosed with concussions that if they went and got a CT scan in the emergency department, they would no longer have a concussion. They would have what's called a contusion or traumatic subarachnoid hemorrhage. There would be radiographic signs of injury there. But we don't scan everybody because for the most part, people come back to, normal function relatively soon. They get hit, they see stars, and it goes away after 10 to 15 minutes, and they're, by all objective measures, normal, right? They might not feel normal, but you look at them, they're talking, they're awake, they're not drowsy or something where you're really worried that you got to get them to a hospital. And most people just say, okay, well, we'll just keep them out of the game for the rest of the day and see how they feel. But concussion is a very non-specific term, but what I want to relay is it does involve that there's been some sort of functional disturbance with your brain, because when that force is applied and your neurons get injured, they release a whole bunch of chemicals called neurotransmitters. And this just makes your brain kind of go haywire for a second. And that's why people will see the flashing lights, or they'll undergo a very brief loss of consciousness, or they'll be a little bit confused. And then as those chemicals start to become back into normal balance, those symptoms go away. But the brain was injured, and the brain does not like to be injured. And we do know that repeated brain injuries can cause a long-term problem, right? Because every time your brain gets injured, it suffers a little bit of a blow, which may be subclinical. You may not notice it, but your brain remembers.
Now, in talking about hits, of course, today, most hockey players are wearing Kevlar shoulder pads, Kevlar elbow pads. So when we talk about player one, when he or she gets hit by player two, if we're talking back at the minor hockey level where they don't have the kind of medical expertise on staff that, say, an NHL club or an AHL club would have, what should the coach and or parents look for from the point of view when their son or daughter gets hit and seems to get hit hard? What kind of symptoms?
Yeah, that's an important question, especially for minor athletes. I think what you have to be focused on is, one, what are they saying? How are they saying they're feeling, right? So these are the sort of in between ones. You'll know if someone has a serious brain injury, it's not subtle, right? They're loopy, they're not making sense, they're unconscious for a brief period of time, they're having headaches, nausea, vomiting that's getting worse. You take them to the hospital. That is an emergency. They need to be seen by medical professionals. Those are not subtle. The ones that we would just play through as kids would be the ones where you come back to the bench, your eyes are, you're seeing stars, your ears are ringing, you've got a headache, any of those sort of things. If those words come out of the mouth of a young athlete, I think coaches, parents, trainers, whoever's around needs to just say, you're done for now. Right. And it's just, you have to err on the side of caution. Remember, we have societally, we've placed a lot of emphasis on what pro athletes are doing. They've got the concussion spotters in the stands and all sorts of stuff like that in the NFL and the NHL. But these are professional athletes who are being paid a lot of money to play a sport. Young people are not protected in the same way, right? This is where we really need as a society to take this seriously. So I have very little tolerance for people who will minimize concussions in young athletes. Because I think that their brains are still developing. We don't want them to suffer head injuries moving forward. We know that that's a risk of all sorts of issues as they get older. So I would say anything that raises your spidey senses at all, that there might have been a head injury here, whether it's headache, ringing in the ears, blurry vision, nausea, just not feeling like yourself, then we have to just err on the side of caution. And one of these things is, we're probably going to overcall things because it's hard with a 10 or 11-year-old to always get an accurate picture of what's going on. But I think we just need to set the standard that if we're at all suspicious based on a collision that happened and how someone's feeling afterwards, that we just say, you know what, you've done, not going back today. We'll get you seen by either a family doctor, or emergency doctor, or some trained medical professional at some point before you're playing sports again.
So obviously at a very early age, the brain is still developing. What age does that continue to? Is there any sort of sense in the medical profession?
Yeah, I mean, you really, we know that. So the term, I'll use a term that's a bit medical. It's called myelination. And what that means is sort of the the development of tracts within the brain and nervous system that connect one area to the other, that happens until your early 20s. So your brain develops for the into early adulthood. We do know that it happens most rapidly in pre-adolescence and adolescence. I mean, most rapidly when you're very, very young, but then the rapid period ends sort of when you hit puberty and those sorts in that sort of stage of your development. But it continues just at a slower pace until you're an adult. So it's something to take seriously with young athletes up into early adulthood.
So how much more sensitive is a young person's brain as they're developing?
That's a bit of a catch-22 because, tissue heals better when you're young, but we do know that young brains are very sensitive to any injury, because we don't want to disrupt that laying down of pathway, that normal laying down of pathway. So that's something hard to quantify, but we do know that, as your brain is developing, it's just very important not to injure it, and, injure it either with physical trauma like concussions, or, that's why we're so fussed about alcohol, drugs, nicotine in young people, because those pathways are still developing, and these sorts of things will disrupt normal development and may lead to problems down the road, whether that's, behavioral problems, attention problems, psychological or psychiatric problems. It just raises the risk of that.
So is there any sense as to if a young player does suffer an incident of some sort, as to how long they should be sitting out?
Well,
is it good enough just to ask him a day later, "Oh, how you feeling, Jimmy?" And Jim said, "Oh, I'm feeling great." Or should there be extra precautions taken?
I think you have to just err on the side of caution, and I would advise our leader. There's lots of excellent resources. The Canadian resource that I was the most familiar with was from Parachute Canada, which was formerly Think First Canada. Dr. Charles Tatter, who is the Canadian neurosurgeon most involved with concussion research and education over the last quarter century. That Think First was his organization. It joined with a couple of other organizations to become Parachute Canada. They have some excellent concussion resources. This is a developing field. I think to just say the next day, "Oh, are you feeling okay?" and yes, and then go back as if nothing ever happened, it's probably not appropriate anymore. Even if a lot of kids would be okay with that sort of mentality, you'd miss some. And I think that the worry is we have to be extra careful with young brains. I see in professional athletes sometimes people come back a little bit earlier than the concussion guidelines would suggest. And I think this is a different ballgame. I think that professional athletes, as I talked about before, they're being well remunerated for what they're doing. They're adults, right? So at some point, an adult has to make a decision based on what they think is best for their body and their family. You look at Tua Tagovailoa, who's the quarterback of the Miami Dolphins. Geez, if I was him, I'm not sure if I'd be playing football anymore, but he's making umpteen $1 million a year to play football. And I think I have to respect the fact that he's going to say, well, I want to play football and I've suffered these head injuries, but I'm going to accept that risk. As adults dealing with young people, they don't have the capacity to make that decision. So we need to be extra cautious. So if they've suffered what we think is a concussion, typically the minimum that someone should refrain from any high risk activity like full body contact participation in a hockey game would be about a week. And that's with a graded return to play, return to sport guidelines that's published online, where you have to undergo specific steps without symptoms before you return to your sport. I think that's the safest way to go. I will say what's changed in the last 10 years has been around the concept of reintroduction of activity and tolerating a little bit of discomfort throughout a rehab, and sort of like rehabbing your brain the same way you would rehab a joint. That as opposed to complete rest until you're symptom free, there has been some evidence to say, well, maybe you should do a light walk and just see how you feel, or read for 10 or 15 minutes and see how you feel, and gradually train your brain to get back up to full speed. But again, this is an ongoing area of research that we don't have definitive answers for yet. Our best evidence is what's published in the guidelines.
Now, you mentioned too a moment ago, when you watch his concussions that he suffered, very obvious, serious symptoms. Does that not sort of lead a person to believe that, you have one and it leaves you very susceptible to the second one, that's kind of a long-term process? And what's he putting himself at risk in keep playing? Obviously, the money element's there and the career's there, but what's he, when we talk about concussions long-term, what are the consequences for him down the road, the potential ones?
Yeah, that's hard. It was hard to watch his last concussion, right? He was unconscious.
Oh.
He had the sort of sensor posturing going on, which is where that one arm sticks out reflexively. And, that's an indication that he suffered a pretty significant head injury. And I was certainly uncomfortable with it. And I would advise him as a medical professional, I would say, look, it's probably time to hang him up. But as we mentioned, he's sort of decided he wants to soldier on. The boogeyman for concussions is really this condition called CTE, or chronic traumatic encephalopathy, which is a diagnosis that really can only be made post-mortem, unfortunately, as of yet. It's similar to other neurodegenerative conditions in that it involves a buildup of tau, which is a protein, a misfolded protein in the brain, which is likely a response that the brain has to repeated injury. We see tau in conditions like Alzheimer's as well, so there is probably some overlap there. It's typically characterized by severe behavioral and psychiatric disturbances as someone gets older. You hear these horror stories of ex-NHL enforcers who have suffered a number of concussions, committing suicide, and having post-sport lives characterized by addiction issues and depression and anxiety. And it's really sad to see. And it's also hard to predict what somebody's susceptibility to that is. Why do some people get it and some people not get it? Or why do, even if some people may have it on their, have those tau buildups within their brain, why are they not symptomatic from it? And it may be just found post-mortem, as opposed to other people who, in their 30s and 40s are starting to have serious signs of this condition. We don't really know. But it is scary enough that I would advise people caution if they have suffered concussions before to try and limit their exposure to head injury. And we do know that, at least in the immediate post-concussive period, you are at a much higher risk. So that's why we don't want people coming back to sport too early, because until your brain is fully healed, a second impact to your brain can be catastrophic. And we have seen really sad cases of something called second impact syndrome, which happens to young athletes often, and they get a second concussion within a short period of time of a first concussion, and their brain swells like your leg would swell. But the problem with swelling in the brain is that there's no space for it to go in your skull. It can't swell out. And when the brain swells within your skull, it actually pushes on the important structures that keep you alive, like your brainstem and those sorts of things. So it can be a fatal condition, and is really, really scary, and a good reason to keep young athletes out of sport until they've fully recovered from a concussion.
So when you talk about CTEs and unfortunately not being able to diagnose until after someone's passed away, MRIs, for example, terrific diagnostic imaging tool, that's not able to pick those kind of things up?
They're working hard on it. I know that there's actually some research that's been happening at the University of Calgary in trying to find radiographic markers for these types of conditions, whether it be just for concussion, because a concussion may not show up on a CT scan, but there may be something you can see on an MRI, or CTE. It's in the works. It's just not ready for prime time yet. And I'm not sure what the time frame would be in terms of when it fully becomes available, but it would certainly be helpful, not just for CTE, but for neurodegenerative diseases in general, right? It's at some point imaging is going to get there. I'm sure with the artificial intelligence boom that we're having right now, neuroimaging and medical imaging is going to make astronomical leaps forward in the next 10, 15 years. And I'm relatively confident that we'll be able to start diagnosing these things earlier. And hopefully if we can diagnose things earlier, we can treat them and, maybe not totally reverse things, but at least treat them to the point where symptoms become manageable or slow down the progression of these things.
So a loaded question for you. What do you think of fighting in hockey?
It depends on what hat I'm wearing. If I'm wearing my ex-hockey player hat, I have one answer. If I'm wearing a health professional hat, I have a different answer. It's hard for, I love my job. Hockey was my first love, and I grew up with it being a part of hockey. I've been in a number of fights myself. Didn't win many of them, but I was in them. It seems to me from a cultural perspective that it's an important part of the game, but I think that sometimes culture has to change, and it certainly puts people at risk, enforcers at risk. Unfortunately, my family was really close with Chris Simon, who passed away not that long ago, and you just think of the fights that those really tough hockey players have been in, the blows they've taken to their head. It's sickening. And then, but the other piece of this, and this is what the hockey purists will always tell you as well, fighting may increase the risk for people that fight a lot, but it allows players to self-police the game and maybe decreases the amount of cheap shots that you're getting. That may have been true when we were seeing a lot more big hits in hockey, but the game has sort of changed. And, I think in the last 10 years, hockey has become a much less physical game, which the old school hockey purists might scoff at, but I think in terms of a player safety and player health perspective is a positive development. You don't see as much counter directional contact anymore. You don't see as much targeting of the head when players are hitting one another. And the game is great to watch. There's an explosion of skill and talent. Guys are doing things in the NHL right now that you just couldn't imagine people being able to survive 20 years ago, right? The way that they handle the puck in dangerous areas, it seems unreal to somebody who grew up playing when Scott Stevens was in the NHL and you went to the middle of the ice at your own peril when he was on the ice. Now things are different, and the game is awesome to watch. So I think that eventually fighting will be out of the game. I just don't know when.
If you were to watch a game of hockey, what would you see that might be done to help better protect the players?
That's a good question. I think the league has, in some ways, the NHL has been slow on the concussion issue in terms of recognizing the link between concussion and neurodegeneration, and their injury reports in the NHL compared to the NFL are laughable. Upper body injury, is it's a pretty generic term, but you see upper body injury, it could be anything from a sprained wrist to a concussion. So I think that more transparency would be helpful with injury reports, because then there could be some accountability as to when somebody came back from something, and questions would have to be answered. If someone comes back earlier, then what would be recommended for something like a concussion. I do think that the way the game has changed in terms of being extremely strict about targeting players' heads has been a positive development. From a health and safety perspective, it's a hard question to answer, because at the NHL level, people are used to a certain physicality of the sport and don't want to see that completely eliminated. What I do think would be the best way to take care of things would be to really protect young athletes. I think that the old saying of You got to teach them how to hit when they're in novice and Adam and Pee Wee, because then they'll know how to protect themselves. There may be a logic to that, but I don't think the benefit is worth the cost of having kids at that age suffer head injuries. So, I don't see any need for counter directional contact in somebody who's younger than 15, 16 years old. Right. So if someone's going to play major junior and they're playing under 18 hockey and they may be a major junior player down the line, then sure, they should maybe be exposed to full body contact hockey before they're put into that environment. But for someone who's in under 16, under 14, whatever age it may be, what's the point, right? Like there's no need to risk that. And, you're putting a lot of kids at risk to potentially benefit a few who might make it to that next level. And I think that's not correct. We should be focusing on the bottom of the pyramid. Let's make sure we take care of young athletes, young children, make sure their brains aren't at risk, in as great a number as possible. So that may be a bit of an unpopular take amongst the hockey crowd, but I would say I'd get rid of full body contact until you're under 18.
Helmets. Has there been really much progress made from a point of view of designing a better helmet, whether it's in football, whether it's in hockey, to really help prevent some of those concussions?
Well, you're seeing those Guardian caps now in the NFL, and they certainly look funny, but that's the size of helmet that really is going to be effective. Like you need a substantial amount of cushioning for the brain so that your skull can move, right? What the problem is, like I talked about in one of your earlier questions, is if your skull comes to a sudden stop, that brain is still moving. So if you can delay the point at which the skull stops by allowing it to have some mobility within the helmet, cushioned mobility, then you could theoretically decrease the force that's applied to the brain. The problem becomes they're a little bit cumbersome, and you look at them and they're kind of funny looking, and not everyone's going to want to wear them. And, it's one of these things. I think the best avenue is to make the game so that it says, you can never eliminate risk, but acceptable level of risk as possible. Helmets are they're part of the solution, but they're not the biggest part of the solution. And certainly you're at a much higher risk if you're not wearing a helmet, or if you're wearing one of those old Wayne Gretzky Jofa helmets. That's not probably the best thing for your head. But I think a targeted approach at the rules and the way the game is played is going to be more bang for the buck.
So when we go back to concussions and you receive a concussion, let's say at the level of a minor hockey, and then very quickly you receive a second one, what's a sense? Is there any amount of time it takes the brain to heal that guys should be very conscious of, or not?
I think that the way that I always look at it, and I've been involved coaching some minor hockey teams during my residency, and being with my background, I get a lot of questions about stuff like that. I think that a single concussion in a young athlete, you're looking at minimum a week for me. That's just, you got to give a week. You got to prove to me that you're totally back to normal. You can go through all the steps of a graded return to play, return to school. You're functioning normally at school for young athletes. That's super important. That comes first. And then you can start talking about getting back into live action after about a week. A second concussion, you're talking months for me. Like second concussion in the same season. If you get one in the fall in a hockey season, then another one in, a couple months later, I think you got to be seriously thinking about taking a month minimum, and then a third one, you're done for the year. Like there's no more hockey this season. And I'd have to refresh myself on what the exact parachute guidelines say on that, but that's sort of all the reason, the way that I've sort of looked at it. And a third one in a season, it's time to start talking about, do we want to be doing this? For young athletes, the question then becomes, well, you can still play hockey, but maybe you don't play full body contact hockey. Very few people are going to make a living out of playing sport, and I don't want to take sport away from people. A lot of what I've been able to accomplish in my academic career, I would say, is because of some of the lessons that I learned in sport. I think there's a huge value in being a part of a team, as an individual working towards a shared goal as opposed to just being, um, worried about your individual goals all the time. So these contact sports, I do think, have some benefit, but we've got to find a way to um, manage the risk. So if you've had a number of concussions, let's say, but you love playing hockey and you don't want to take that away, and you say, well, you can't play full body contact hockey. You play a level that doesn't have full body contact hockey. You get a lot of the benefits of physical activity, team environment, leadership skills, those sorts of things. But let's manage the risk here. Let's keep our eye on the long term goal of whatever it may be you want to do with the rest of your life.
We talked earlier about football and Tua and his concussions, and I think that really brought a spotlight on football. And I was doing some research the other day, and the NFL especially seems to have done a lot in the last year or two to start to really seriously address this issue. Based on the knowledge you have, is the NHL taking a similar approach, or are they a little bit behind? There's a group last week in Boston that studied this issue, and CTEs in players that have passed away, and they came out and they not so kind as to their thoughts on maybe the NHL has not taken this serious enough. What are your thoughts?
Oh, I totally agree. I think the group in Boston has been sort of the main drivers of this research. There are all sorts of advocacy groups now. Concussion Legacy Foundation is a big advocacy group for this out of the United States, and the NFL really had their feet put to the fire with everything that happened in the early 2010s. I don't know if everyone watched the movie Concussion, but that sort of really caused a big issue with the NFL, and legal things do tend to change behavior, and the NFL was under some significant legal duress, and that's probably a reason why they were more forward thinking than the NHL. The NHL is getting a little bit of heat for this now, and you're seeing lots of sad stories come out, but they didn't suffer the serious cultural backlash that the NFL did when all of these findings about CTE were being made public. So I would say the NHL still has a ways to go in terms of catching up with the NFL. Like I mentioned about the injury reports earlier, it's just laughable, right? You see what's an upper body injury, what's a lower body injury. You may say you're trying to protect the player's privacy and you don't want opponents targeting them, but that's the wrong mentality for a sport to have, right? You need to be transparent and make sure that you're taking care of the players. You don't allow other people to target them, because if you do, if someone is targeting an injured player or targeting somebody's head that's just back from a concussion, there should be severe repercussions that would be, more than just the 2-minute elbowing penalty that somebody might have gotten in the 90s.
Now, we talk about and we use the term concussion. I've often felt that that's a big mistake from the point of view, and it almost implies something soft. Is there actually a better term that we should be using to describe when a player gets hit to the head and they're taken out of the game? And normally we might have called it, well, he may have suffered a concussion. What should we be calling these injuries? Well,
in reality, they're a traumatic brain injury, and there's a lot of, and the literature is there's a lot of controversy in the literature as to whether you call things concussion versus you call it a mild traumatic brain injury or a traumatic brain injury, or how you want to name it. But we just need to get the population to understand what concussion is. A concussion is an injury to your brain. And I'm biased. Brain is my field of interest, so I think it's the most important organ we have in our body. It allows us to be who we are. We should protect it, right? When we say someone has a torn meniscus or a torn ACL, that implies a certain severity of injury. That they're going to miss X number of weeks with a torn ACL. You say, oh, that's a really bad injury. Well, why don't we say the same if someone suffers a concussion? I don't know. It's hard to say, but we just need to have that understanding that a concussion means that you injured your brain, and your brain, at least for a small amount of time, is not going to function the way it normally does. hopefully it recovers to a state where it's normal, or as normal as you can get it based on your injury history. But we should be very, very clear that that's what a concussion is. You have injured your brain.
So if you're an athlete and you're listening to our podcast today, and perhaps you've suffered over the past 1, 2, 3 concussions or whatever, and this is a question you certainly should be able to answer. When do you know it's time to hang up the skates with the cleats or whatever?
Yeah, that's a hard question because there is benefit. I still play some men's league hockey. It's one of my favorite things to do. I think there's a tremendous benefit in getting together with some friends and playing a sport, and it's a social outing, and allows you to be physically active. But everyone's got to have their own sort of risk tolerance. And I think for some people, their risk tolerance may be higher than others. I do think that if you have a concussion where you feel like it's taking you a long time to get back to normal, or you're not quite normal yet, you should give serious thought to limiting your risk. And maybe instead of playing hockey, you find another sport that you can do with other people that is less risky. Or you play at a lower intensity level. Maybe you don't have to play in the top men's league or women's league in the city. You just get out there and play with people that's a slower pace. Swallow your pride a little bit and play with people who might not be out there as competitive. I know men's leagues can get pretty competitive, and sometimes it seems like you're playing for the Stanley Cup when everyone's got to go to work on Monday. But anyway, it's one of these things where everyone's got to make that decision for themselves, and it's a good idea to have a discussion with their healthcare provider and talk about what's important to them. If you say, I'm an engineer, like I can't function at work if I'm having a hard time looking at a computer screen and calculating these different things. Well, maybe you should not be playing contact sports and putting yourself at risk of more head injuries. So it's hard to know. It's a bit of an individualized decision.
Yeah, you talk about having to go to work on Monday. As it relates to the work environment, in your practice and of medicine and dealing with the brain, have you dealt with many individuals who've suffered concussions or brain injuries on the job as such?
Well, so as neurosurgeons, we see a lot of brain injuries. Concussions typically don't make it to us. Sometimes when we're at the pediatric hospital in residency, you'll get called about somebody who suffered a concussion, and maybe they're just not quite back to themselves yet, and you want to watch them overnight. But in terms of adults, we see a lot of head injuries from work. And there are people who do risky jobs for a living, right? And there are people who are involved in heavy machinery and have very serious head injuries on the job, which is always really, always really sad. And you feel awful for them. But in terms of concussions, we don't treat a ton of them as surgeons because they don't require surgeries. But we do have a very good understanding of what happens in a brain injury. What is the physical things that happen with inside the brain in terms of the brain moving around and how it gets hit and what area of the brain might be affected. And then what's happening at a cellular level when a brain gets injured in terms of the chain reaction that gets set off with those neurotransmitters being released and your brain not functioning properly and the types of symptoms you might have from that. So I think that neurosurgeons certainly have a role in the discussion around concussion, but also you look at family physicians, emergency room physicians, rehabilitation doctors, physiatrists, neurologists, allied health professionals such as physiotherapists. These people all have a role to play as well, because a lot of times they'll be more hands-on with managing concussion patients than a surgeon will.
Now, when I watch sports, and for example, hockey, football, and they talk about an arm injury or shoulder injury, I often think, well, we know so much about those, and we know so much about the healing process and how to get someone back 100%. how much you mentioned we do know a lot about brain injuries, but how much really do we know about brain injuries?
Oh yeah. I mean, it's a growth field, right? So this is an ongoing area of research. Part of it is it's harder to visibly monitor the recovery that's happening within the brain, um, because it's hidden from you, and it's happening at a cellular level, and the function that's lost might not be something that's clinically obvious, right? So there are parts of the brain that aren't obviously important on the outside, like to somebody observing someone, but they're very important to that person in terms of how they feel, how they function at a subconscious level. And I think that's what makes it so tricky is, if you have some frontal lobe dysfunction, that could be in a quote unquote silent area of the brain where you can walk and talk and sound normal and appear to every observer like you're totally back to yourself. But there can be some subtle changes in your cognitive processing and your behaviors that wouldn't show up unless you did very dedicated neuropsychiatric or neuropsychological testing, which is just not practical to do for everyone that suffers a concussion, whether it be at work or in sport. It's very intensive, and really the benefit of doing it on everybody would probably be a lot of healthcare resources spent. So it's hard to gauge progress the same way as it is with your range of motion in a joint and your ability to weight bear and your ability to stride when you're playing or when you're skating or would it be like that. The frontal lobe doesn't have a great test for it outside of these very dedicated neuropsych assessments. And I will say that when I made my decision to stop playing hockey, I did undergo a very intensive neuropsych evaluation, and that weighed into it. So I do think that has a role, especially if you're considering to stop playing. It's just the availability of these tests can sometimes be a little bit limited. And the typical testing that you do for a concussion in terms of a SCAT test, like the sideline concussion assessment tool, that is a much cruder assessment than these formal neuropsych tests done by a trained professional neuropsychologist. That is a hours long battery of tests that gauges how your brain, different areas of your brain are functioning.
So look, Matt, you've achieved so much to date. Last question. What's next for Mad Eagles?
Oh, thank you.
Any long-term goals?
Yeah, well, so my family's here in Chicago with me right now. I've got a wife who is a rheumatologist. She finished her residency training in Calgary at the same time I did. And we've got a 3-year-old, 3.5-year-old now, daughter who's just the best part of our world. And we are planning on moving back to St. John's, Newfoundland, where we went to medical school and practicing there when I'm done fellowship here in Chicago, and looking forward to getting back to the East Coast of Canada and a little bit closer to home, closer to family for us, which will be helpful, and also just that's where we feel like we belong.
Now, your father also extremely well known in the hockey circles. What's he up to these days, Mike?
Yeah, Dad he retired from his job as the AD at St. Thomas, not that long ago, and he has been keeping busy. He's a different beast. he likes to do triathlons for fun. So he actually just went to the World Triathlon Championships in Spain, and he comes out and visits us a lot. He's a very involved grandfather, and we're so thankful that he can come out and help us, because both of us are sometimes we have unforgiving schedules. So we do rely on family help, and we certainly wouldn't be able to make it work. Both of our schedules work without help from people like my dad, my mother-in-law. We've had my grandmother, my dad's mom come out and help us, and my mom's sister come out. It takes a village, but we're very fortunate to have family that are involved in helping us with Anne Marie, who is lots of fun and keeps us on our toes.
Well, look, Matt, thank you very much for joining us on today's podcast. We wish you and your family well. Certainly, you're in a field that there is so much to learn, so much new all the time. But you've certainly provided a lot of things, I think, for people to think about, whether you're a parent, whether you're a coach, or you just have an interest in the topic. Thank you very much. So for our
Thank you.
listeners, stay safe. We'll see you next week.